Hi, my name is Darcy Dzurino, and I'm going to be performing therapeutic massage. My patient came in complaining of a knot and some tightness in her gastrocnemius muscle, so I'm going to be performing an active release technique, which is a deep tissue massage technique that applies a significant amount of pressure to an area while the patient performs active muscle contraction, and this is used to break up some adhesions and some scar tissue in the area. I have my patient in a prone position, and I draped her accordingly so that I could have access to the calf area. I have screened her for contraindications and precautions previously. So now what I'm going to do is I'm going to assess the skin and just check for some sensation. So am I touching you?
No.
How about now?
Yes.
Alright, so now that I've done that, I'm going to clean the skin with an alcohol swab. And now I'm ready to start my treatment, so I'm going to go wash my hands. For this treatment, I'll be using massage cream. I'll be using a small amount, but that's adequate enough to cover the treatment area. Alright, so first I'm going to perform a little superficial effleurage just to spread the lubricant around and to assess the skin and look for any areas of tissue restriction. Once I've done that for a while, I'll move into a deeper effleurage. And after I've done this, I'll change into a petrissage, which is more of a kneading motion. And it's just kneading the muscle fibers in a perpendicular fashion. And I'll be looking to break adhesions and to find an area where I can work further on. And I'll continue this until I find an area where I want to perform my active release technique. And actually find one right here in the lateral head of the gastroc, so now I'm going to be performing my active release technique. Now that I've found an area of tissue restriction, I'm going to apply a significant amount of pressure to this area. I'm going to ask the patient to actively point their toes and then bring their toes to the table. And I'm going to ask them to do this about 5 times while maintaining the pressure on the area. And once more. Perfect, good. And then I'm going to release my pressure and I'm going to reassess and just see if I can feel a softening of the tissue. And if so, then I'll just return to my petrissage and then finish with my effleurage. But if the tissue still seems a little bit tight, I might want to do the active release technique again. But in this case, I'm just going to continue with petrissage and then finish off. And then I'll move into a deep effleurage. And then a more superficial effleurage. And I'll just continue that for a few minutes until the patient is relaxed. And then I'll take a towel and I'll towel them off. And then use some alcohol to clean the skin and to get the lubricant off. And that will complete my treatment. So total treatment time varies for this type of technique because I could have had to complete that active release multiple times in order to break the adhesion, but in this case it was about 15 minutes that it took me to complete the whole massage. So it might be a little uncomfortable for the patient while I'm actually doing the treatment because I am applying a significant amount of pressure to the area, so I'd alert them of this. And also we hope to see some softening of the tissue after treatment and also some increased range of motion and strength and also some improvement in circulation to optimize healing.